observed repetitive use range of motion. So this is where you'll have the veteran move the joint an additional 3 to 5 times and then measure with the goniometer. If there's any additional loss of function or range of motion after those repetitions, then you'll want to state yes, document the endpoint, and then select from any of the factors here that would contribute to that loss. If there's no additional loss of function or ROM after those repetitions, then just state no. And then at that point, we don't need anything noted here. And if you do mark something down here, it just needs to be NA. So that's 3B, observed repetitive use range of motion. Below that is 3C, which is repeated use over time. This section is used to determine if the veteran would have any functional loss after they've been using the joint or extremity for hours and hours at a time. So maybe functional loss seen at the end of the day. So this first question here will typically be answered no. Is the veteran being examined immediately after repeated use over time? If the veteran ever did come into your exam after having just worked out for a few hours, they were jogging, walking, using stairs for a prolonged period of time, that could potentially warrant a yes response, but otherwise there'll be no here. Then you'll go down to this question: does procured evidence, including statements from the veteran, suggest pain, fatigability, weakness, lack of endurance, or incoordination, which significantly limits functional ability with repeated use over time? Okay, well, really quickly, here's the pop-up. So if you ever get that, just make sure to say yes, and then go up or down to save your work. Which significantly limits functional ability with repeated use over time. So per the VA, if there's no anticipated reduction in the degrees of range of motion from what was provided in 3A, then the factor that's selected is not considered to be significantly limiting functional ability, and this would have to be answered no. So if there is expected to be a decrease in range of motion with repeated use over time, then you can select yes, select from the factors that contribute to the loss. And then in this section here, because you're typically not examining the veteran immediately after repeated use over time, this would need to be your estimation of the anticipated range of motion in that scenario. So to the best of your ability, based on your physical exam and also statements from the veteran, you just want to provide this estimation the best that you can. The VA really does prefer for this estimation of range of motion. If you truly can't provide it for some reason, then you'll want to come down to this box here to explain why an estimation isn't possible, and then also to discuss the available evidence. Any questions about this section?
No. I started
Okay.
started videotaping it. It's a lot.
It is a lot, I know. So, okay, once you get it down though, it should hopefully not be as intimidating, but okay, so the flare-up section is next. The same guidance you're using to complete 3C, you'll also use to complete 3D. So if with flare-ups, there's expected to be a decrease in range of motion, then you can state yes, select from your factors, and then provide the estimation of the anticipated range of motion. If in 3C or 3D, the second question's ever answered no, then you don't need to do anything else in the sections. You can just leave the rest of this blank. 3E is for additional factors contributing to disability. So this is to address any other factors contributing to disability that weren't already addressed above. So if there is anything else that you need to discuss, you can make a selection here. You can also write something in if you need to. Just make sure that anything selected here does also have a corresponding description in this box.
Okay.
Then we have questions about muscle atrophy. So only answer for the claimed side, which for this case is actually both, but and then if there is atrophy, you'll be asked for the measurements for the normal side and also the atrophied side. If both sides are symmetrically atrophied and there isn't a normal side, you just want to make sure that you do explain that somewhere. Ankylosis is the next section. So ankylosis for VA purposes means a frozen joint or zero movement. So if there's even the slightest bit of movement noted in the active range of motion section, then this would need to be answered no. This is the joint stability section. Are you familiar with how to do the various instability tests? Did you say yes?
Yes.
Okay, awesome. Okay, so just make sure that you follow the wording of the questions. Anything in blue is going to be helpful when you're answering these. So first, is there any recurrent subluxation or persistent instability? Yes or no. Has there been a ligament tear or a sprain? This is really asking about two separate conditions. So it's possible there's been a sprain, but not a ligament tear, or vice versa. If there wasn't a ligament tear, but there was a sprain, then just make sure that you provide a clarifying statement in the remarks section. But if there is a ligament tear, then let us know if it's complete or incomplete, and answer 6C. So was the ligament tear repaired? If yes, was it successful? Did it fail? 6D is to address any assistive devices used for ambulation that were prescribed by a medical provider. So if there's no evidence of a prescription, then we would need to say no. Also, 6D only needs to be answered if 6A or 6B are answered yes. So this question is only referring to assistive devices prescribed for subluxation, persistent instability, ligament tear, or sprain. So if no to those, then you would just leave 6D blank. 6E is to address if there's any recurrent patellar instability, and if there was some instability, was there any surgical repair for that condition? Also, if you do answer yes, then you can answer this question as well. Was there an assistive device used for ambulation that was prescribed? So answer that too. Section 7 is for any tibial or fibular impairments. So stress fractures, shin splints are noted here. If there are shin splints, these are if there was any kind of treatment. Then we get to meniscal conditions. Anything selected here, we do need a corresponding description. Also, just wanted to point out, does the veteran currently have or has the veteran been diagnosed with a meniscus condition? So it's possible the veteran has been diagnosed in the past but no longer has that condition. So maybe they had a meniscal tear that was surgically repaired, and so there's no current symptoms. Just make sure that you do describe all of that there. Any surgical procedures, just be sure to include that date of surgery. Other pertinent physical findings, this is the catch-all section of the report. So anything else you need to let us know about the diagnosed conditions, that can go here if needed. And then right below that, you'll always see a question about scars. So for any of the musculoskeletal exams, if there are any scars or disfigurement related to any of the diagnosed conditions, to include the treatment of any of those conditions, then you'll be asked to add and complete the scars DBQ. So you would need to click on this gray button that will add the scars DBQ to your list at the top, and then you'd want to complete that as well.
Okay.
You do have an option for the skin DBQ, but you're not going to use this one. Typically only will be this one.
Okay.
Assistive devices. So this is actually a section where you can report assistive devices used for ambulation that are not necessarily prescribed. So if there's no evidence of a prescription, you can still document it here. So if the veteran does use any of these, just be sure to specify frequency of use and then fully answer 11B. Remaining effective function of the extremities is to address if the functioning of the joint or extremity is so diminished that amputation with prosthesis would equally serve the veteran. So typically this will always be answered no. Then we get to diagnostic testing, which is going to be broken up into two parts. The first part, 13A through 13C. This is where you would provide a report of results done in conjunction with this exam, meaning you put in a request for imaging, or we already had imaging ordered up front based on the claimed condition. So basically, if VES is doing the diagnostics or the imaging, that will be considered in conjunction with. If you're simply reviewing records and you find imaging in there, that will instead go in 13D. But regardless of which section you complete, or if both are completed, just make sure that you always answer this question here. So anything that is abnormal in the results above, we need that to be attributed to a diagnosis. If there's something that doesn't warrant a diagnosis for some reason, but it's technically abnormal, we just need some kind of statement here to address it. Then we get to functional impact. So this part is really important for rating purposes. So this should only ever be from your point of view, your opinion. We cannot have any veteran reported statements here. If you believe any of the diagnosed conditions would affect the veteran's ability to perform any occupational tasks, including standing, walking, lifting, sitting, you'll select yes, provide a description, and at least one example of the types of activities that would be affected. If the veteran is retired, that doesn't disqualify this from being yes. If you believe the condition would affect their ability to work if they were still employed, then you can still say yes here. So yeah, just make sure you do get an example in here.
Okay.
And then we get to the remarks section, which is not a required section, but I have mentioned it quite a few times in the session. Anything extra you need to let us know about the veteran, the exam, clarifying statements about the report, if there's no evidence to support a diagnosis, just really anything and everything can go here as needed. If there were critical findings, you'll document the steps you took, just anything like that. Below the remarks section, you'll always see the life-threatening finding questions, and this is to address if there were any current imminent life-threatening findings, meaning the veteran left your office in an ambulance or maybe met that high acute risk for suicidal ideation. If yes, in those situations, then also just be sure that you answer the follow-up questions. And then down here we have, as you can see, the Save button and the Submit Worksheet button, so these will always be at the top and bottom of each DBQ. And that is the knee DBQ. Do you have any questions about this one or about
Nope, I'll just
musculoskeletal
have to look
exams?
over it. I'll look over it again before.
It's a lot. It is a lot of information. Okay. Great. Well, let's go ahead and do you want to look at the migraine DBQ? Headache
Yes.
migraine DBQ? Okay, this one's much shorter. Yay.
Mm-hmm.
So we have a claim of migraines. This is all going to be the same as the previous DBQ, in person, records reviewed, VAE folder, all available records were reviewed. We have a tiny diagnosis section, so there's migraine, tension, cluster. You can write in other, so like, I don't know, post-traumatic headaches or TBI or whatever. Well, not TBI, but the diagnosis of headaches by itself is not considered a rateable condition.
Okay.
So if the veteran does have, you don't know the type, but you need to do something like headaches, you can actually diagnose common headaches, and that's actually considered a rateable condition. So not headaches by itself.
Okay.
Medical history. Medication can also be OTC stuff, so it doesn't have to be prescription medication for 2B. Section 3 is to report symptoms. So what kind of headache pain is there? Is it localized to one side? Does it worsen with physical activity? Are there any non-headache symptoms associated with the headaches? So any of these here. And then indicate the duration of the typical head pain, and also indicate the location of the typical head pain. So there is a little bit of overlap in 3D and 3A, so just make sure that the way these are both answered are consistent with each other. The next section is prostrating attacks. So does the veteran have characteristic prostrating attacks of migraine, non-migraine headache pain? If yes, you'll select the frequency. And then does the veteran have completely prostrating and prolonged attacks of migraines or non-migraine pain? This is completely prostrating. So if yes, then you'll select the frequency here. Then we get to the other pertinent physical findings section. We get to the scars question, which is set up a little bit differently. In this situation, you only need to complete a SCARS DBQ if the scar is painful, unstable, greater than or equal to 39 square centimeters, or is located on the head, face, or neck. So if it doesn't meet this criteria, then we just really need the location and the measurements. However, if it's a scar related to headaches, it's likely going to be on the head, face, or neck, so you probably still would have to complete that. Diagnostic testing, so we don't, typically do anything for these types of claims, but if there's something applicable in the records, you can document that here. Functional impact, would it affect their ability to work? Remarks, life-threatening finding questions, and then there's the save and submit worksheet button. And that's it.
That was much shorter.
I know, much less painful. All right, well, let's go ahead and look at this medical opinion, and then we can look at some of the other cases if you'd like.
Okay.
So there's two parts to the compensation and pension exam. The first part is determining whether the veteran has a diagnosis related to the claim, which is what you'll do here. Second part is addressing whether those diagnosed conditions are related to the veteran's service in some way. So that is the purpose of the medical opinion. As you can see in this light blue box, this is where the medical opinions are listed. So for this one, they're asking for you to address 3 separate medical opinions. This one's asking about the left knee condition, this one's asking about the right knee, and then this is asking about whatever you've diagnosed for the headaches. Down here, additional information. This is just going to be information from the records that could be helpful when you're providing your opinion. So it looks like there are lay statements from the veteran, so definitely want to consider those things. If you ever see the 3 words potentially relevant evidence, that's information the VA has found to be specifically related to the claim, and so you'll always want to make sure that you do review that information, discuss it in the rationale, and then just also make sure to specifically state that you reviewed that information. And then down below that, we usually have the veteran's branch of service and service dates listed. So we already know the veteran was in the Army from, are they still in service? No, 2011. I don't know why there's no release date here. But yeah, 2011, and then we can look at the DD 214 to find out for sure. But 07, 2012, 11, 2012, 03, 2017 to 05, 2018. So those are the periods that you're going to be considering as to, are these conditions incurred in this time of service, or are they otherwise related to it? So the first thing you'll do in a medical opinion is highlight the requested opinions. You can also take the additional information or the potentially relevant records. So copy that.
Mm-hmm.
And then you'll scroll down here, section 2, restatement of requested opinion. This is just going to be a copy and paste of the requested opinions right here. That's all we need.
Okay.
And then 2B is going to be the name of the DBQ that you completed. So this will be knee and headaches. You can put DBQ if you'd like. And then the first part of any medical opinion will be the instructions of where to actually address this opinion. Please complete section 3. Please complete section 3. So when we go down, section 3 is populated. This is where you'll address all 3 opinions. If you're rendering a positive opinion, you'll select 3A. If you're rendering a negative opinion, you'll select 3B. Regardless, we always need a corresponding rationale. Since you are addressing several different conditions, it's possible you might have some that are directly due to service, some that are less likely than not due to service. If that's the case, it is okay to have both selected. Just make it clear which condition is positive and which one's negative.
Okay.
When you're providing your rationale, there are 3 parts to a good rationale. The first part is providing a clear opinion, where you state the specifically diagnosed condition and use the legally recognized terminology for either a positive or a negative opinion. So positive opinion is expressed with at least as likely as not. Negative opinion is expressed with less likely than not. The second part is citing specific records that you reviewed that help support your opinion, citing medical literature that helps support your opinion. And then the third part is providing your additional medical rationale, your explanation, how you arrived at that decision. So the thought process that helped you arrive there. So just make sure you do include all of those things. But looking at the opinion, please complete section 3, state whether the veteran's medical records support that any currently diagnosed conditions related to the veteran's claimed left knee condition. So this means anything diagnosed for the left knee will need to be addressed in medical opinion 1. Sometimes the claim will be much more specific. So let's say it was left knee meniscal tear. Really only anything that you've diagnosed related to the meniscal tear needs to be addressed. But since this is such a vague or generalized claim, we do have to address all left knee conditions. For this one, all right knee conditions. And then this part is our at least as likely as not. Likelihood is at least approximately balanced or nearly equal, if not higher. So this part is taking into account the VA reasonable doubt doctrine, which states that if after you've reviewed all of the available evidence, there's just as much evidence indicating the condition is due to service, but just as much indicating it could be due to something outside of service, then you can go ahead and rule in favor of the veteran. So just keep that in mind because that is important. And then this last part, incurred in or caused by active duty during service. Sometimes this gets a little bit confusing, the wording. Just know that the main takeaway is, was it incurred in or caused by service?
Okay.
So that's the main part there. Now I want to show you an example of a good rationale in the medical opinion guide. So let's go to training by specialty, scroll down to general medical, and then we're going to click on this guide here. And I'll send you this as well. So here's an example of a good section 3 positive medical opinion. So for this particular opinion, it is asking about headaches. Please complete section 3, state whether veterans' medical records support that any currently diagnosed conditions related to the claimed headaches is or at least as likely as not incurred in or caused by the headaches during service. So we go down here, section 3 is populated, 3A was selected because it's positive, and then here is the rationale.
Okay.
So the veterans' currently diagnosed migraines are at least as likely as not related to the headaches during service. Then it goes on to list the different service treatment records, which document that there are headaches, and then there's also ongoing documentation of the condition from the time of service to present day. So that's another big part of those section 3 opinions that I forgot to mention. Especially if the veteran's service was a long time ago, we do need some kind of statement or some kind of documentation of chronicity of the condition from service to present day, or continuity of care, or both. So anyway, this has all of those components.
Okay.
So that's an example of a good section 3 opinion. Below that, if you want to see an example of a negative opinion for section 3, you can find that. So section 3 opinions for direct service connection are the most commonly requested opinions. The second most commonly requested will be section 4, which is for secondary service connection, where the VA wants to know if one of the veteran's service-connected conditions has resulted in a new condition to occur. So an example of that might be, is the veteran's neuropathy approximately due to or the result of the veteran's diabetes mellitus? So that would be a secondary service connection opinion. So is the condition due to their diabetes, not is it due to service? Questions about the medical opinion?
Nope, I'm glad you're going to send me them.
I'm going to send you all kinds of things.
Okay.
So yes,
Well,
definitely.
I appreciate it.
Yeah, no, for sure. Do you want to go ahead and look at some of the other cases? No pressure if you feel that you're done as well.
Yeah, let's see, let's go through them and see which one, let me see what they are.
So the
Bilateral
foot
foot.
is
Is it
a
pretty
little
straightforward?
different. It's pretty straightforward, but just one thing to know about the foot DBQ is that You'll always complete section 1 and 2. You'll also always complete 11 through the rest of the report. But sections 3 through 10, you only complete it if there is also a corresponding diagnosis.
Okay.
So just keep that in mind. Like if there's not pes planus, then when you get down to this section, then you don't answer anything. Don't even say no here. That'll get you an addendum. Just leave it blank.
Okay.
So only complete the section that applies until you get down here.
So if they bring the records in
Mm-hmm.
and there is a diagnosis, I put it in there and then just have them give it to the VA to
Right.
upload?
And they do need to definitely get those submitted. But just make sure that you do, specifically state the veteran brought in the records
Okay.
and what
And
exactly it was that you reviewed. That's the other important part. Yeah.
Okay.
Also this DBQ pain is addressed in multiple sections, so there can be some overlap. So just, make sure to be aware of that. Let's see what the opinion is. I want to see if it's an aggravation opinion. It is. Okay, so this is another thing. So this is section 5 is for aggravation of a pre-existing condition. So the only conditions that can be addressed here are conditions that clearly and unmistakably existed prior to service, which means there's evidence on their entrance exam that they had that pre-existing condition. If you look at that entrance exam and there is no pre-existing foot condition, then it's automatically a negative opinion because it did not pre-exist service. So just keep that in mind. Otherwise, yeah, you just complete section 5 down here. The other thing is, if you do provide a positive opinion, you're going to be asked to provide the baseline level of severity of that condition, any evidence of the increased worsening of that condition, and then a rationale that covers everything. So the baseline level is going to be the earliest evidence of the condition prior to any aggravation. So typically, like an enlistment exam is going to be the baseline if it's available. Especially for the feet, a lot of times it will say like if there is pes planus, if it's asymptomatic, or if it's mild. So that's what you would put here. And then just any evidence of it becoming worse during service. You want to document that here, and then the rationale can really just be, it can probably be just a copy and paste of your opinion, your rationale from up here. But those are all the things you'd want to document to show that there's an aggravation.
Okay.
All right, let's go here, see what else we have. I know we have respiratory. Did we look at the second? Okay, that's the one we did. Sinusitis, pretty straightforward.
Okay.
Not very lengthy, which is great. Again, for this DBQ, you're, based on the condition you diagnose, you only have to complete that section. So sinusitis, rhinitis, you only complete part B down here. Anything that you diagnose that's not addressed in these sections, you'll need to address here. Doesn't look like you have any service-connected exams. Oh, but sometimes just make sure that if you do have any questions below the blue line that you do address those. This just wants to know, again, did you review the records?
Okay.
Respiratory, so you will have pulmonary function tests for this one, unless there's cancer. We don't necessarily do them in that situation, but so various conditions to select from. This is a DBQ trigger. If the veteran, if their condition or their claim is attributed to sleep apnea or narcolepsy rather than a respiratory condition listed on this DBQ, then you could potentially be adding and completing the sleep apnea or narcolepsy DBQ in lieu of this DBQ. So that doesn't happen a ton, but it can happen. Any medication, just note that for the medication, it's within the past 12 months usually. Or wait, is this one not? never mind. It's not the last 12 months, so just disregard that. A lot of the sections will ask if there's more than one respiratory condition. They want to know, if a medication is taken for more than one, which one is predominantly responsible for the need for that medication.
Okay.
There's another question like that later on in the PFT section. So this is similar to sinusitis DBQ. So if you have asthma, simply complete Part A. Anything that you diagnose that doesn't go into these sections does need to be addressed here. So you select
So I'll
the
have
option.
to search for the pulmonary function test?
So that's the thing, is there should be one that is already scheduled, and I don't know why there isn't unless there's something already available. Let's look at the records really quickly. I just want to take a quick look and see. Yes, it's not going to open now. Yeah, this means it's not going to open. I don't know why it does that. But we do the PFTs, if we use them, they need to be, I don't think they can be any older than a year.
Okay.
So if you don't happen to find anything within a year, then we
Schedule.
definitely need to have it. Yeah. So, and I'll just go ahead and write this down so I can look into it. Let me just write down the veteran's last name.
So I really thought that these were just test patients, but I was looking at all the stuff.
Yes. Yeah, these are your actual veterans.
Okay.
How do you feel? This is a pretty full schedule for your first day.
Yeah, that's a pretty full schedule, but I see 40 patients. I mean, I do a lot of DOT physicals, I do a lot of physicals. This is just different. The wording is different, so I just got to get used to it.
For sure. No,
I have a couple days to get it submitted, so I can manage.
And you can go in here ahead of time. You can go in records ahead of time.
Okay.
You can start saving information in the DBQs if you want. All that. So feel free to do that as well. Let's see. Any other questions? Let's see what else. We do have a male reproductive DBQ. There is a physical exam for this one. So let's go down here. This one's also pretty short. Most of the sections, or based on the condition, they'll want to know the etiology if possible. There is the potential to add and complete a kidney DBQ if there's any renal dysfunction due to any of the diagnoses.
Okay.
But yeah.
Renal or urinary?
Renal.
Okay.
Kidney.
Okay.
So maybe if there's like prostate cancer, or maybe I don't know if that's something that would happen regularly, but renal, yeah. Okay, so voiding dysfunction, erectile dysfunction, retrograde ejaculation. For these, if you don't know the etiology, you can just, of course, select etiology unknown, so that's fine too. Any male reproductive organ infections, UTIs, epididymitis, which is, I think, the claim for this case, that would be addressed here. So the first part is going to be asking whether a chaperone was present for the physical part of the exam. If no, then we just need to know if either the veteran declined the exam altogether or if they just declined the chaperone.
Okay.
And then for each of these, if it's abnormal, you'll just want to make sure that you do select what's abnormal. There is a prostate exam. If it's not medically advisable to perform for some reason, then it's perfectly fine to select that. Just provide an explanation.
Okay, yeah.
This is where prostate cancer would go, this section here. The other thing too, about if there is cancer on a lot of the DBQs, you also, if there's any residuals associated with those conditions, you'll be asked to add and complete the most appropriate DBQ to further evaluate that specific residual. So if that ever happens and you need to add a DBQ, you would have to go up to the top here, go to add worksheet, and then go to whatever one you need. Let's say it's spread to the bones. You would add the bones DBQ and then click add, which would add it to your list.
Okay.
yeah, that's pretty much it for this one.
So these veterans have already gotten the address and the instructions and the.
Yeah, they get sent a little packet that has the address,
Okay.
directions, how to get there,
Okay.
and all that kind of stuff.
Okay.
Yeah, definitely. So, and then any other questions or anything you want to go over while we're here?
No, not that I can think of.
Okay. All right. Well, thanks for joining me for the training. I do know that it is quite a lot of information to digest all at once, so I appreciate your time. And I am going to go ahead and send you an email with a bunch of
Okay.
reference materials
Okay.
that will also have my direct contact information. So if you have any questions about anything before your exams, please feel free to reach out. If I'm not available, provider help, you can reach out to them. We do also offer something called a post-exam review session, where
Okay.
after your first exams, I would review some of the cases myself, and then we would meet again over Zoom or over the phone to review them together.
Okay.
Is that something you might be interested in?
Absolutely.
Okay, great. Do you want to go ahead and get it scheduled, or if you need to look at your schedule
Yeah, I
first and
need to
get
look
back
at
to
my
me, that's
schedule.
fine too.
I think I'm.
Okay,
Yeah, I think I'm pretty
I get
booked.
it. Okay, okay. Yeah, just let me know, and we can get something set up.
Okay.
Well, thank you again for your
Thank you,
time. I do
Claire.
appreciate it. And let me know if anything comes up, any questions.
Okay.
But otherwise, I hope you have great